Okay, hello everyone. I'm Ignacio Paradelo. I'm an aesthetic doctor here in Madrid, and also I'm an Amir academic teacher. This evening, I wanna talk about you the lips treatment with hyaluronic acid. Also, I will talk about some anatomical concepts, and to finish, I will mention some complications that we can have when we do this aesthetic procedure. So let's begin with this webinar. Okay, to begin, I am going to talk about the importance of the perioral area. The perioral area in aesthetic medicine consultation is not determined because it happened to me, but because there are studies that demonstrate it. There is a study carried out in 2018 where 8,464 patients were questioned about their biggest concerns regarding aging and which areas had the most impact on them. And as we can see, flaccidity occupied only 7%, while loss of lip volume, a marked nasolabial fold, and perioral wrinkles took the majority of the percentages of concern. So, based on these results, we can conclude that the aging of the perioral area is one of the items the most concern women while aging. Sorry about my English. I would try to do the best. And if you have any doubt or any question, you can write to me in the chat and I will answer at the end. Okay, when we analyze a face, lips plays an important role in facial identity. They are a fundamental component in the personality of the person. Look, for example, Angelina Jolie, who has full and important lips, giving a very sensual appearance to her face and following in harmony with the rest of her features. But if we replace those lips with others, thinners, we are completely changing the face of the actress. The lips express emotions also, and they are a weapon of seduction and sensuality. And as I just mentioned, small changes in the lips can generate great repercussions on our patient's face. So that is why to achieve a perfect mouth, it's important to perform an analysis of our patient's proportions to determine what is the best treatment for the patient, for our particular patient. Okay, when we analyze the proportions, it is very important to take into account the patient in front of us and the difference that we can find according to the different ethnicities, countries, ages, and modes. According to the ideal of beauty, in the case of the Caucasian patients, the lower lip should be a little larger than the upper lip, while in Asian or African patients, that proportions tend to be the same for both lips. If we analyze the lip in profile, following the Ricketts line, we can see that the lips of the Caucasian patient should be located slightly behind the said line, the Ricketts line, with the upper one being to the farthest away between 4 millimeters and the lower lip between 2 millimeters, which coincide with what I just mentioned, that the upper lip should be slightly smaller than the lower lip. In the case of the Asian patients, both lips should touch the line, and while in the African patients, the lips must exceed that line. Okay, when we talk about lip aging, we can mention different factors that favor said aging. There are intrinsic factors such as genetics and extrinsic factors such as smoking and solar radiation that are the most important factors in the aging of the lip. Also mention that the volume demand is determined not only by the loss of the lip volume, but also by the structures that make up the entire perioral area, such as the teeth, the bones, etc. As they age, the lips rotate inward and perpendicular wrinkles become marked. Wrinkles are less pronounced in men thanks to the presence of the sebaceous glands. That's why we usually don't have that perpendicular wrinkles. Also, another particularity is that the lower lip ages better than the upper lip. And finally, a very characteristic feature of aged lips is the marking of the marionette lines and the depression of the mouth corners. So, in order to treat a lip with hyaluronic acid, it is important to take three pillars into account. One, it's the patient's need. Two, the injection technique. And three, choosing a suitable product. When we talk about our patient's needs, according to the degree of the aging, we can classify lips into 3 degrees. Grade 1 will only need gentle profiling. It is a patient between 20 or 30 years. Grade 2, it's a patient with between 30 and 40 or 50 years. In addition to profiling with hyaluronic acid, it will be these lips will benefit from volumization or hydration. And in case or in grade 3, there are patients older than 60 years. In addition to definition, projection, and hydration, they will. It's important to carry out a restructuring of the entire perioral area. It's common that patients without teeth they need to be to replace those teeth before they put hyaluronic acid on their lips. And on the other hand, it's important to take into account, in addition to the degree of the aging that our patient presents, what is the profile of our patient and their expectation. For example, if it's a patient looking for a naturalness and harmony, or if it's a patient who wants a lot of volume and more exaggerated result as Russian lips, for example. It depends on that what treatment we are going to do. Also, it's important, the choice of the product is another important instance, since there are numerous variations between the different commercial companies, and at the same time, within the same commercial company, there are variations between its products. For example, the Merck laboratory has 2 types of hyaluronic to treat the lips, one for volumization and another one to contour. Then if we use dioxan, we can use the type 3 or type 4. If we use Galderma, also we have special ones to treat the lips. And also if we use Allergan, we have different type of hyaluronic to treat the lips. So we must choose a hyaluronic with a medium cross-linking so that it can adapt well to the lip tissue and avoid the formation of granulomas and migrations. That's one of the complications that we have to avoid when we're doing this procedure. Also, it's important to know, and before performing any type of aesthetic medicine treatment, it is very important to take into account the anatomical knowledge to avoid any type of complication, and that is what I am going to talk about now. In addition to knowing the different layers that makes up the perioral region, it is very important to know its arteries and their root. In the anatomy, we have the skin, then we have the subcutaneous fat, then the orbicularis or the muscle, that's the muscle of the lips, then the mucous membrane, then the facial artery where it's going to born the upper labial artery. So this is a typical scheme that we all know of the vasculature of the perioral region. The facial artery is responsible for originating originating the superior labial artery, which then continues upward as the angular artery. Here's the facial artery, then becomes the superior labial artery, and then it continues facial artery and then the angular artery. As for the inferior labial artery, it can usually be a branch of the facial artery, as we can see here, but also can originate from the modular artery, as we can see it in here in the right, or labiomental artery. There is a study carried out by Sebastian Cotofana, a great anatomist, a German anatomist, that where the different anatomical variations found in the superior labial artery and inferior labial arteries were published. I think that this study is very interesting you to know, and you can find it in Google. It's a free study, so I think it's a really interesting study you to read it. But in this computed tomography image, we can see the birth of the superior labial artery. This is this one from the facial artery. We know the facial artery becomes from here, goes up, and when it reaches the modular or the corner of the mouth, runs the superior labial artery. This is the most common variation. But in this study, Cotofana, they describe 6 types of variations. In this another image, we can better understand the findings found. Variation type 1 is the most common, as I said, and is the one that I was just telling you about right now. We have the facial artery, and then the superior artery, and the angular artery. Then the type 2 is the same anatomical findings as we can see in type 1, but with the particularity that the upper lip also receives irrigation from the infraorbital artery, as we can see here. And as we can see, the same happens in type 6, much less common than the previous ones, but these communications between the infraorbital artery and the superior labial artery is what we have to take into account when performing our filling treatment with hyaluronic acid, because it's in this case of embolizing the superior labial artery, thanks to this anastomosis that we're seeing here or here, it is possible to embolize the central artery of the retina, or the central retinal artery, sorry, and produce blindness. And that's the most free complication that we have to avoid. In this image, this anatomical knowledge is very important, and knowing which areas or which are the regions that carry the greatest risk and which are the ones that allow us to work with greater safety. When we analyze their route within the lip, we can observe that in a large percentage of cases, the labial arteries run through the lip on its mucosal side. See, in this side, being very infrequent to find them on the border between the dry mucus and the wet mucus. See, as we can see here, in the mucus side is where run the most, in the most cases, the artery. So is where we have to avoid with the needle. By analyzing the depth of the arteries with an ultrasound, it can be seen that the location of the arteries in most cases is at the mucosal or intramuscular level, as we can see it in here. And in this image, in this scheme, we can see it better. The arrangement of the arteries is better evident, where in 80% of them are located at the mucosal level, then 18% in the intramuscular level, and just only a 2% in the subdermal level, what gives us the guideline that working at this level, in the subdermal level, superficially is the most correct way to avoid embolization of the arteries with hyaluronic acid. Sorry. And as we can see here also, the different localization of the artery, those one are the most common localization, and we have to avoid when we introduce the needle. This scheme represents with the blue line, this one in here and in here, represents with the blue line the safe area of the lip for filling with the hyaluronic acid. And here we can see at the histological section level a well-performed upper lip treatment with hyaluronic acid, since the product was placed above the artery at the subdermal level. Here is a natural lower lip, and this one is with a hyaluronic acid that we can see it in here, and here is the artery. Okay, so we now know our patient. We know the product that we are going to use. We know the anatomical knowledge, and now we have to choose the injection technique. Regarding the different injection technique, we can use a microcannula, which being a blunt instrument, significantly reduce, the possibility of embolizing an artery. See, and I usually recommend to use a microcannula with 25G, that it's bigger than 27G, so it is safer. And if you don't want to use a cannula, you can use a needle, and I recommend to use a 30G needle. Then to deposit the hyaluronic acid, there are different techniques, which will depend on the instrument that we use. If we use a cannula, we can use a linear threading, or if we use a needle, we can do a bolus or a depot, a fanning technique, or a layering technique. Also, if we use a needle, we can use a linear threading in the superficially of the lips. And the suitable product that we talked before. And then when we finalize our treatment, there are some indications that we have to give to our patient, as avoid massaging to the treat area, because a massage is going to pronounce the inflammation. If inflammation or pain appears, they can put a local cold or take a paracetamol. They have to know that normal inflammation lasts a few days, between 24 or 48 hours. They have to avoid non-steroidal anti-inflammatories because of the risk of bruising. Good oral hydration with water. They have to hydrate it with water, because the hyaluronic is a product that keeps water, so they have to drink water. If an hematoma appears, they can use different creams to treat the hematoma, and to also to avoid inflammation or to prevent the hematomas, they have to avoid sports or intense physical activities in the next 24 or 48 hours. And we have to make a review after 40 days. Okay, as we talk about how we do the procedure and the anatomical and the importance of knowing the anatomical layers, now I want to introduce some complications that we can have when we do the lip treatment with hyaluronic acid. In general, temporary filling materials have a very low incidence of complications, unlike permanent fillings. Most are mild or limited complication, as bruising or edema, that we can treat with local cold, avoiding non-steroidal anti-inflammatories, and using creams that treat the bruising. The most common complications are asymmetries, That's why we have to review our patients after 15 days. And the most feared complication is the vascular embolism that I mentioned when we saw the vascular arteries. The initial evaluation is important to detect asymmetries. That's why it's too important also to take pictures and photos of our patient before the treatment to recognize the asymmetries and to show the patients that they already had the asymmetries before the treatment. And it's always better, and I always recommend to undertreat and then retouch than to overtreat. It's also know that we can use hyaluronidase, but it's always better to undertreat and then do a review after 15 days, and then we can put more hyaluronic acid, but not to overtreat, because if we overtreat, we're increasing the risk of complications. Okay. One of the most complications are the nodules or the granulomas. Nodules are a chronic inflammation in response to that filler. They can be inflammatory or infections. Fillings can be activated even years after being placed, and that's something that we have to take in our minds, because usually when they appear, the patient doesn't or they forgot about the treatment with hyaluronic acid. So that's the importance of a very good clinic interview. To manage a non-infectious inflammatory nodule, we can use hyaluronidase in low doses, in 2 or 5 international doses. If we use hyaluronic acid, because if we use another product, we cannot use hyaluronidase. And if it's needed, we can use corticosteroid infiltrated and or topical corticosteroids. We usually don't need in a non-infectious inflammatory nodules, but sometimes we can use antibiotics or use also an ultrasound or a biopsy. When the suspicion is of a nodule with an active infection, we will see sign of phlogosis. So in this case, the most important thing to do is to do an incision and drainage that infection, and take a sample collection for culture, and give antibiotics to our patients. And another thing to know is that we have to avoid hyaluronidase because it promotes inflammation. So if we are if we are treating a granuloma, a non-infectious inflammatory nodule, we're going to use hyaluronidase and corticosteroids. And if we're treating a infectious nodules, we have to do an incision, drainage, and put antibiotics and avoid hyaluronidase. Another complication that we can have when we treat the lips, it's the herpes. That's why it's always important to ask about the possibility of an hepatic reactivation. If we have a patient that have frequent episodes of herpes, we have to do a prophylaxis that we can do it with valacyclovir, or the most usual treat prophylaxis is to use acyclovir 800 milligrams 1 per day, 3 days before and 3 days after the treatment. And if appears the herpes after the treatment, we can use valacyclovir 1 gram 3 per day, plus anesthesia, and we can use zinc sulfate. And the last complication and the most feared one is the vascular embolism. The vascular embolism can be caused by any type of filler, even with autologous fat. That when we do surgeries, fillings. Okay, there are 3 dangerous areas of the face that we have to take care. One of them is between the eyebrows, because we have the supraorbital and the supratrochlear arteries. Another one is the nasal size because of the angular artery, and the other one is the corners of the lips because the facial artery. And the occlusion can be acute, so we are going to have the acute ischemia, and the progressive occlusion that will produce in skin necrosis. Okay. If the embolism is progressive, we are going to have the skin necrosis, as I said. So the first minutes, we're going to see the whitening of the skin, and the patient will say that she had a lot of pain. If we don't see that and the patient go home, a few hours after, it will appear a libido reticularis that's in erythematous and violet lesions with vesicles. And if the patient doesn't say anything and pass a few days, the necrosis of the skin is going to appear. So if we want to treat this kind of necrosis, we can use hyaluronidase, but with the higher doses to treat than we used to treat a granuloma. To treat a granuloma, we use 2 or 5 international units. To treat necrosis, we're going to use 50 international units. And the time to treat it is it's on the first 4 hours, ideally first 34 hours, to reduce the consequences. And every 40 hours, we have to review the progress. And it's also important to do a previous allergy test, because hyaluronidase is a really allergic component. So before we use the hyaluronidase to treat the granuloma or to treat the necrosis, we're going to pick just 1 international unit, and we're going to put it into the arm, and we have to wait about 10 or 15 minutes. And if it doesn't happen anything, we can use the hyaluronidase. But if it happens an allergic reaction, what we have to do, if it's a granuloma, try to treat it with another way that it's not the hyaluronidase. And if we have necrosis, we can try to use it, a hyaluronidase, in lower doses, and having a corticosteroids with us in case that we needed to use it. And the acute ischemia is the most feared complication that we can have when we do the lip treatment with hyaluronic acid. And because, as I said before, that anastomosis between the superior arterial artery and the infraorbital artery can cause the vascular embolism, then can cause the occlusion of the central retinal artery and produce the blindness. The clinic that is going to refer our patient is a sudden intense eye pain and loss of visions. And to manage that blindness, some studies say that we have just 90 minutes, but another studies say that we have just 15 minutes to treat that embolism. And to treat that, we have to do a retrovulvar injection of hyaluronidase in high doses. To treat a granuloma, I say we can use 2 or 5 international units. To treat a necrosis, I said that we have to use 50 international units. But to treat the acute ischemia, we have to use higher doses, as 500 international units. We have to do the retrovulvar injections and put a lot of hyaluronidase to try to save the retina. A lot of ophthalmologists say that it's very difficult to save an artery that has a vascular embolism, but we as doctor have to try to do all that stuff that's in our possibility to treat that acute ischemia. With this, I don't want to scare you, but just to close this webinar, I would like to finish with this image that represents a beautiful lips. But in order to reach that result, we must first know, the anatomy very well, carry out a correct clinical history, and adequate evaluation of our patients about what they need and what are the things that we as a doctor have to tell our patient that needs. Not know also the different techniques and choose the right product in order to achieve a beautiful result and avoid any type of complications. Okay, I hope that this class was useful to you. And if you have any questions, you can write me in the chat. Okay. If you have any questions about the master or any academic question, you can write me to the chat, or you can write me to my Instagram. That's dr.ignacio Paradelo, my name and my last name. If you have any question about the master, you can also write to to Amir. I don't know if you have. Okay, I will wait a few minutes. And if you don't have any questions, it was a pleasure to me. I hope this webinar results interesting to you. If you are already aesthetic doctors, remember always to know the anatomical concepts and to work safe. And if you are interested in or interested to do the master, you can write me and I will try to help you in anything that you need. Okay, it was a pleasure to having you in here. Bye-bye.